What's up, guys? I'm Dr. Tim Pavlak. I'm a physical therapist. I'm the owner of Physio Orthopedics and Performance. We are a specialty sports medicine clinic located in Cuyahoga Falls and Hudson. In Cuyahoga Falls, we are inside of Cuyahoga Falls CrossFit, and in Hudson, we are in Life Center Plus, which will be opening in a week or two. Follow us online and check us out at physioorthoperform.com. That's physio, P-H-Y-S-I-O, orthoperform.com. I wanted to address a topic today that is a common question that I have during almost any evaluation or speaking engagement, and that is, do I perform acupuncture? And is acupuncture the same as dry needling? Just to get out of the way, I do not perform acupuncture. I do not have any specialty in Eastern medicine, nor am I familiar with it. So if you were to have a question about acupuncture, I would simply refer you to that sort of specialist. What we do perform is dry needling, and where that common area of confusion is it's the same tool. It's a needle that is as thin as the hair on your head, which is good because it leads to decrease pain and decrease annoyance using that needle to go into the muscle. A lot of times people think needles and they think the needle that is used to either take blood or give fluid, which is a hollow needle. And so these ones that are completely solid are a lot less painful, a lot less irritable to the muscle belly itself. The theory behind it and the transition into Western medicine really came with John F. Kennedy. He had something called myofascial pain syndrome, which is irritable spots over the body, hyper-irritable spots, knots, if you were. His personal physician was Janet Travell, and she found that whether she injected him with lidocaine or saline, he would have a reduction of that muscle spasm and a decreased pain sensation to palpation in that muscle belly. That led to the theory that maybe it isn't the injection fluid, whether it's that lidocaine or that saline, but maybe possibly it's the needle itself that's releasing that muscle tension. So there's that transition from using a hollow needle that's more irritable and painful, which is why people hate getting shots, to a very thin needle that is a lot less irritable and painful. So basically the idea is that we are removing muscle tension. So the idea of a trigger point and a knot are two different terms for a similar idea. It's a spot where those muscle fibers are contracted. So as opposed to being in that relaxed position, they're irritable and contracted, which leads to that pain and that decreased motion. With the needling is very effective in that, say I'm working on someone's muscle tension who has knee pain and the quadriceps are the problem, and we go in, I have 3 superficial, 1 deep muscle. Well, how do you get that deepest muscle? You could go through and use metal tools or use your hand or do cupping, which are things we do here, or we can go straight down to the problem, go to that deepest level and use that needle. Where it's kind of cool and very tangible is that if you ever had a sports massage, a lot of times the practitioner will say, this feels like a knot, and you're like, heck yeah, it feels like a knot, it's irritable, it's really painful, it's annoying. And they say, oh, I felt a release. And even though they may have felt that release, it's really tough because you're not aware of it. So needling is a little bit different, being that we can actually use, and in research they've used an ultrasound machine that identifies that density where you go into that muscle and you can see a darker spot. Ultrasound measures density. You see a darker spot in that muscle where the fibers overlap, which generates that change in a darker hue of gray. And that helps identify that knot. And now once you put the needle in, this is a portion where you will feel the release, because what you feel is a twitch sensation. It's called a latent twitch response. Basically what that is the muscle reacting to the needle. And the best way I describe it is like a miniature muscle spasm. And following that muscle spasm, there is a release. There is some soreness associated with it, but a lot of times the range of motion changes right away. So just a little background on dry needling versus acupuncture. If you want to, check us out online on physioorthoperform.com. You can email me directly at drpavlak, that's Dr. Pavlak, at physioorthoperform.com. Let me know if you have any questions. I hope to see you soon.